Hi, Dr. Sasse here from Sasse Surgical. So which kind of weight loss surgery is most effective? To answer that question, you really have to balance effectiveness against side effects or risks. You want to kind of think of both of these together. We measure the effectiveness side based on pounds lost, so that's logical, the amount of weight lost, and ideally over the long haul, not just in the short term. And then we also measure it by reversal of health conditions or improvement in health, specifically type 2 diabetes. We know that weight loss surgery helps with a lot of other health conditions too, like it reverses sleep apnea in most people, it reverses high blood pressure in most people, it helps resolve bone and degenerative joint disease and pain and liver disease and many other things. But one of the most measurable is type 2 diabetes, so we kind of use that both as its own important measure, but also as a surrogate for improving other health conditions. So the most effective weight loss procedure over many, many decades has been the one that's done the least, paradoxically. That's called the duodenal switch. Another name for it that you might run across is biliopancreatic diversion, or BPD. There's subtle differences between the two, but for this purposes, we just call them all duodenal switch. And that procedure used to be done with an open surgery, and it had a lot of side effects and complications, as well as some risks involved with the procedure itself. And so for that reason, it never really caught on, especially in the United States, and it isn't done as widely. However, in recent times, centers like ours and plenty of others have gotten a lot better at it. The procedure's gotten refined, and so it's once again had some resurgence, but I think it still only accounts for around 2% of all weight loss surgery in the United States. Nevertheless, you'll see about 90% of excess body weight often lost in many reports and 80% kept off over 10 plus years. And you'll also see diabetes reversal rates approaching 90%. So that is truly the most effective. However, because of that history of side effects like diarrhea and vitamin deficiencies, hair loss, skin changes, nutrient malabsorption, it has a little higher side effect profile than the other procedures. So what's number 2 on the list? Probably gastric bypass, or Roux-en-Y gastric bypass. Very high effectiveness. Many studies would show 75% or so of excess body weight lost. Maybe at the 10-year mark that would be somewhere around 55 or 60%. And a very high rate of diabetes resolution, maybe in the 60 to 70% range, and less side effects, complications than the historical duodenal switch, but still definitely some malabsorptive type symptoms, some side effects resulting from the rerouting of the intestines, blockages, internal hernias, a little bit of hair loss, skin changes, and then one that we find a little bit troublesome that's maybe a little off the radar, which is hypoglycemia, or low blood sugar episodes that can occur years and years later. So, good results or excellent results, little bit of a side effect profile that we'd like to improve upon. And that's really what left the door open for the sleeve procedure. So that'll be the third one I'll mention. The sleeve procedure's effectiveness is right up there with gastric bypass, so very similar, kind of maybe a few percentage points below it in some studies. Other studies show the two basically neck and neck and statistically equivalent weight loss results. Diabetes resolution close to that of gastric bypass. In some prospective randomized trials like the Cleveland Clinic trial, they were absolutely even Steven, 5 years later even. In other studies, you see a little bit of advantage to gastric bypass, but either way, they're very, very similar. But the side effect and risk profile is way lower in the sleeve gastrectomy. And so that combo is what led most surgeons and most centers to begin offering the sleeve procedure as the primary procedure. That combo of very similarly high effectiveness but way lower side effect profile, that ratio, that's what made it the cat's meow. That's why the sleeve is the number one most often, most asked for and most performed procedure around the world and in the United States. Lastly, I'll give mention to a fourth procedure which is rarely done nowadays actually, and that's the lap band procedure or gastric band procedure. So the effectiveness of it is quite a bit lower on average than any of the 3 previously mentioned procedures. A good place to go confirm this for yourself would be to look at the Swedish obese subjects study, which is in the country of Sweden, going 20 full years in duration. And you'll see that in a fairly objective kind of population-based study that the amount of weight lost from the band was less than half of that on average of that of the gastric bypass, or what we would think as the sleeve today. And as you look at the long-term side effects of it, once you get 10, 15 years out with the band, we see a real uptick in the amount of people having side effects with difficulty swallowing, dysphagia, erosion, and need to have the band and device removed. So there you have it. Those are kind of the main four. Are there other procedures? Sort of. They all tend to be variations of the procedures I just described. We could address some of those kind of niche procedures in other videos, but I don't think that they really change the equation very much in general from what I just described as the sort of overarching outline. I do think it's important, though, if you're thinking about weight loss surgery for yourself, that you get an opinion from somebody who's very experienced and who actually has good knowledge and history with all of the procedures. I think that you're liable to get a good, objective, sound opinion, and you want that surgeon or center to put themselves in your shoes and try to offer the best advice as though you were their brother or sister or mom or dad, because that's really how you get the best advice and personalized advice about what would be best for you. Because although the sleeve is probably the best answer for most people today, it's probably not the answer for everyone. There may be circumstances where you'd be better served by having the duodenal switch. For example, if you have severe type 2 diabetes, or perhaps the BMI is a lot higher. Or you might be better served having gastric bypass if you have severe reflux and you've got Barrett's esophagus causing worrisome changes to the esophagus. So those are some considerations that a surgeon and a center with a lot of experience and know-how, not just somebody who only does one procedure and that's all they do, can give you really sound advice. I hope that's been helpful, giving you the lay of the land on all the procedures, and as always, I wish you great health.